Childbirth. It can seem like this huge, unpredictable, maybe even scary event, right? But what if I told you it's not really a mystery at all? That it's actually a beautifully designed biological process that we can understand? Well, today we are going to crack that code.
So is it just total chaos, or is there a code? I'm telling you, there is absolutely a code. It's this incredible, intricate dance with some very clear choreography. And once you see the steps, the whole thing starts to make a lot more sense. And to guide us through it, we're going to use the exact same framework that doctors and midwives use. It's called the 5 Ps. Think of it as our roadmap for this whole journey. We'll start with the blueprint, then we'll meet our passenger, figure out how they navigate the passageway, understand the power and psychology behind it all, and finish with the final push. You ready? Let's dive in.
Okay, first up, the blueprint. You might think labor starts with the very first contraction, but it actually starts way before that. It's all about the planning and the prep work that sets the stage for everything to come.
And this planning can kick off as early as the first trimester. We're talking about big decisions, like where is this all going to happen? A hospital, a birthing center, at home? And who's going to be on the support team? Every one of these choices helps create the unique environment where this whole incredible process is going to unfold.
And here's a little insider info for you. Part of that professional prep involves a system called GT-PALE. It's kind of like a secret code for healthcare providers. It's a super fast way to summarize a person's entire pregnancy history so the whole care team is on the same page from the get-go. Pretty cool, right?
All right, let's move on to our very first P, the passenger. And yeah, we're talking about the baby. But the baby isn't just passively along for the ride. Oh no. Their size, their position, even how they're holding themselves, it's all a critical part of the code for a smooth journey out. So first, you've got something called the fetal lie. All this is how the baby's spine is lined up with the mom's spine. The goal here is a longitudinal lie, where they're parallel. I mean, think about it. It's like trying to get a car out of a narrow garage. You have to be lined up straight. If you're sideways or transverse, a vaginal delivery is just not going to happen.
Next up is fetal attitude. This is all about the baby's posture. Ideally, we want a flexed attitude. That means chin tucked to the chest, arms and legs pulled in super tight. The baby literally makes itself as small and compact as possible. It's like a diver getting into that perfect tuck to make the smallest splash.
And finally, for our passenger, we have fetal presentation. This just means which part of the baby is leading the way out. And what you're hoping for is what's called a cephalic presentation. That's head first. Why? Because the head can act as the perfect wedge to open up the path. And the way it does this, well, it's nothing short of genius.
See, the baby's skull isn't one solid piece of bone. It has these amazing soft spots called fontanelles, which allow the bony plates of the skull to literally shift and overlap. This is called molding. It is a brilliant biological hack that lets the head temporarily change shape to fit through the birth canal. It is just nature's engineering at its absolute best.
Okay, so our passenger is ready for the journey. Now it's time for our second P, the passageway. This is the route the baby has to travel, and it's a journey with very specific landmarks that tell us exactly how far along we are.
The way we track this progress is with something called fetal station. It's basically a numbering system going from negative numbers to positive numbers that tells us precisely where the baby's head is located in relation to a key landmark in the mother's pelvis.
So with all these numbers, -3, -2, +1, +2, what's the single most important one? It's this one, 0. Station 0 is the magic number. It means the baby's head is perfectly lined up with the narrowest part of the pelvis. This is it. This is the moment of full engagement. It's the point of no return.
And this image just illustrates it perfectly. I love what the baby's saying here. I'm at 0. From here, it's all positive. I'm on my way out. Before this point, all the stations are negative numbers, but once you hit 0, you're in the positive numbers, which means the baby has cleared the tightest spot and is officially on the home stretch.
So we've got our passenger and we've got our passageway. But what's actually driving this whole journey? Well, that brings us to our next 2 Ps, and they are deeply connected: power and psyche. This is the engine and the mind of labor, and they have to work together.
The power is all about the uterine contractions. We can feel how strong they are just by touch on the outside. That's what's done for most labors. Or in some situations, a tiny catheter can be placed inside for a super precise measurement. This raw power is the force that moves the passenger through the passageway.
But here's the thing. That physical power is hugely influenced by the psyche. I mean,
Think about it. When you get scared or really stressed out, what does your body do? It tenses up, right? The exact same thing can happen in labor. High levels of fear can actually release hormones that slow things down. But a calm, supportive, positive mindset, it can do the exact opposite, helping the body work way more efficiently. The mind and body aren't just talking to each other, they are true partners in this dance.
And that brings us to our fifth and final P, the one that really ties everything else together and puts the mom in the driver's seat for the final push. This last P is position, and it is a total game changer. For a long time, women were often just told to lie on their backs, but now we know that moving around is so important. Changing positions isn't just about getting comfortable, it actively helps things along. It can improve circulation, fight fatigue, and, most importantly, it uses gravity to help the baby make its way down. It's the final key to cracking the code.
So when you put it all together, you see it's this beautifully interconnected system. The passenger, the passageway, the power, the psyche, and the position, they all have to work together, in harmony. If one of those pieces is a little out of sync, it can affect everything else. It's not just a process, it's a partnership.
So childbirth isn't chaos at all. It's an incredibly sophisticated code, an intricate dance between mother and baby. And while we know the steps, every single performance of that dance is completely unique. So after going through this whole journey, from the blueprint to the final push, what part of this incredible code do you find the most remarkable?